especially if you've gone on to have surgery for the kidney stone. That can drag on over several procedures even, and of course they can come back. And I think one thing that's really relevant to talk about right off the bat is, you know, just from my perspective, when I'm counseling patients about this and what their options are, a lot of times if they're, depending on not necessarily BMI, but we're talking about the distance from the skin to the stone, that can take things like shockwave lithotripsy off the table and, or at least make it a lot less effective. And so I think that's why it's important for two reasons. One is because you're at a higher risk for kidney stones, based on BMI, and they've looked at various BMIs, and the magic number is somewhere around 28, but I don't think that part is as important. But also, it can take some surgical options off the table for you or make some of your surgical options less effective, which is really frustrating, and I totally understand why that would be frustrating. I think more importantly, there was one good study done that looked at post-bariatric surgery related weight loss and how it impacted stone risk. And basically what you saw was that as well, there's two main things. One, the caloric intake, of course, goes down, but also the increase in activity. And then the people that were able to do that, they had a lower stone risk. And I think that's cool because it looks not just at people who've experienced weight loss, but specifically after bariatric surgery. So obviously there's a lot of implications there. And I think one thing, again, that is a general topic is that, on your weight loss journey, you're going to have an improvement in a lot of parameters, especially things like metabolic syndrome and diabetes, which I can't personally speak to as a urologist, but all of those things can increase your risk for stone down the road too. So as you improve those other health parameters, it can only have a positive impact. One thing that you may hear about or may have read about at this point when it comes to kidney stones and bariatric surgery is there are certain things that, from my perspective, make it a little bit challenging to prevent stones. One of the biggest things is it's you have to pace your water drinking a little bit after you've had bariatric surgery. In fact, I see patients like this all the time, and they have to get a little bit creative with their water intake. They've got to get their water intake up to improve their stone risk. But on the other hand, it's a little more difficult after surgery. But I think far and above the benefits that you get are going to far outweigh some of the things you might encounter after surgery. So there's just multiple things you can say about the positive benefits of weight loss and specifically bariatric surgery related weight loss on kidney stone risk. And if God forbid you do get one, it can leave some surgical options on the table for you. So there's a lot to consider there. One of the other there's really a couple other general urology issues that people can get that I think are severely exacerbated by obesity and being overweight. One thing that I see probably most commonly in my practice, I see it all the time in clinic. But again, I'm not here to just give you anecdotes about what I see. I'm happy to share with you some of my personal experience. But I also like to present the hard data, the objective data, because, as a patient, that's probably what you're the most interested in, not just what I have to say or my own personal feelings about it. But that would be things like overactive bladder and getting up at night to urinate. These, to me, are some of the most frustrating problems to have as a patient because it interferes with your daily life. And some people, it interferes with their life so much they don't do things they used to do. They're not as comfortable going to the store, going out with friends, because they're so worried about their overactive bladder. And this is something that impacts women and men. I think oftentimes in men it gets, shoot off as their prostate issue, but definitely men can get overactive bladder symptoms as well, and it's very frustrating. But there's been multiple objective evidence that weight loss shows to improve all of the parameters of overactive bladder, urinary urgency, urinary frequency. And so I think that one's a really important one because it's not like you break your leg and you go and get it fixed. If you come in with overactive bladder, it's a group effort, and it's a lot of effort on the patient's part to try to make their symptoms better and go away. And even though there are medications for it, those medications have a lot of unsavory side effects, and it's very hard to get people to remain compliant with them. And I understand why, because they get side effects and they can be costly drugs. And most people I meet don't want to be on a new medicine because they're typically already on a few medicines. So definitely overactive bladder is something that's been shown time and time again to improve after weight loss. And they've done studies on post-bariatric surgery weight loss and how much it can impact. Now, a lot of these studies were lumped in with, overall female pelvic health, pelvic organ prolapse, stress incontinence, which there have been positive effects in all of that. But I think it can affect men just as much as it can affect the women. So, and again, that's an annoying problem to have. It's a difficult problem to have. It's also one of those things that as you embark on your weight loss journey and things like diabetes start to improve, well, you're definitely going to see a positive impact on your bladder health. If we get the glucose out of the urine, that eliminates the things that are irritating the bladder. Glucose is very irritating to the bladder and can cause recurring infections. And so it's not just the direct impact on the bladder that weight loss can have, but it's the secondary things in your health that are going to make your bladder, it'll make you a lot happier. And the people that have been compliant and really work hard to make some of these changes, they've just come back and they're so much happier and their quality of life is so much more improved. And that brings us to something I have lumped into this, which is getting up at night to urinate. There are some people who wake up every half hour to an hour to urinate at night. And in some ways that can be lumped into the overactive bladder group, but not necessarily. There's other things that cause it that are independent. Some overweight people can have is sleep apnea, and I see this all the time. I typically, when I can't get to the bottom of it, I'm very early to send somebody for a sleep study and see if they could benefit from a CPAP, because oftentimes nighttime urinary symptoms are independent of the daytime urinary symptoms. However, of course, it makes sense that if you have daytime overactivity, you probably will at night as well. And that's just one of those things that it sounds sort of mild to say out loud, but if you're living it and experiencing it, it can really interfere with your day-to-day. And especially if you're not sleeping at night, well, that has many negative implications. So I think those are, the topics that seem maybe not so exciting to talk about, but are really, really important. And it's a huge part of my practice because it affects so many people. So can only stand to make improvements there. And another one that applies to all people, probably more so women than men, but all people, is the increased risk of kidney cancer that's associated with obesity. So I think this one's an important one because there are some inherent risks that somebody can have for kidney cancer: genetic predisposition. There's also just sporadic genetic mutations that can occur that can cause someone to develop a kidney cancer. And when I refer to kidney cancer, I'm talking about renal cell carcinoma. It's what arises sort of from the main tissue of the kidney. But there are certain things that somebody's just born into, and they have no ability to control their risk for it. But there's two things that are risk factors that are in a way controllable, and one is smoking, and I think that's a fairly well-known risk factor for various malignancies out there. But the other is obesity. And so I think, if you're aggressive on your weight loss journey, which I'm sure many of you are, then it can only improve your risk from a kidney cancer standpoint. And I think it kind of goes back to what we were talking about when we talked about kidney stone surgery, which is you're going to do better with surgery, even if, God forbid, you had to have it, if you've lost the weight. So I think that's important for two reasons. But that's been a known risk factor for kidney cancer for a long period of time. Before I go any further, are there any questions? Hopefully I'll be able to see those about the topics we talked about. Maybe not.
Good. No questions right now.
Okay, good. Thank you for keeping me updated. I don't know what our audience is, male to female ratio. There's certain things that, and again, these are things that I see most commonly. But there are certain things that can affect your urologic health, depending on if you're a man or a woman. And some of these are, probably not the most fun topics to talk about, but they're things that I talk about every single day with patients. And I feel thankful that they're comfortable talking to me and coming to me with their issues. But certainly obesity has a huge impact on men's health and women's health specifically. I'll talk about the ones that affect men first. I think one of the hottest topics there is to talk about in general when it comes to obesity and urology, and not only that, but a very well studied topic when it comes to post-bariatric surgery weight loss and obesity and men's health is low testosterone. We call it hypogonadism, but low testosterone. There's actually a word for it, and I don't use this that frequently, but MOSH is the word for it. Male obesity associated secondary hypogonadism. So not that anybody needs to remember that, but it should just tell you how important and what a big deal this is and what it's become. I think most people know already what the symptoms of low testosterone are, or at least how they wind up coming to see me in the office with their symptoms. And that's usually things like lethargy, fatigue. I don't feel like I used to. I don't have the energy I used to. Erectile dysfunction, low libido. And I see men in their 20s with this. So it can occur starting at a pretty young age. And, I think this is something people debate on a lot in terms of, do you go on and start these people on testosterone replacement therapy? Do you try to get them to make lifestyle changes and stuff? And I think it's just this revolving door, and it's really comes down to you and your doctor having a heart to heart. But there has been a very well documented and well studied correlation between obesity and low testosterone. And it's easy enough for me to sit across from you and say, well, go exercise, eat a healthy diet, get some good sleep at night, and watch your stress levels. Well, we all know all of those things are easier said than done. And I commend the people that are able to walk out the door and make those changes. On the other hand, sometimes it's hard to find the energy to go exercise, and you're not sleeping well at night because maybe you're up all night with waking up due to sleep apnea, you're waking up to use the restroom. So it's kind of one of those things. It's hard to correct one without correcting the other. But there have been several very well done studies, not just small case series here and there, well done studies looking at the positive benefits of weight loss on increasing the testosterone level. And in fact, there's some great books out there about this that were written not just by urologists or clinicians, but by a variety of people. I've read some of them myself. But if you're ever interested in that topic and want to go down that rabbit hole, there's a lot. So check out Amazon. But as it relates, there have actually been studies looking at post-bariatric surgery weight loss on the effect of testosterone levels in men, and they're all, pretty overwhelming. In fact, how well people did. I tried to get some statistics for you all just because there's so much information out there available. I think they said over 87% of men, one of the biggest cohorts, over 87% of men had an increase in their testosterone level, and not only that, but saw a subjective improvement in their symptoms, which that's always important. It's nice to see your blood work improve, but you want to make sure you improve, you yourself, if your symptoms are improving as well. Things that are changing for any science nerds out there: your sex hormone binding globulin is changing, your testosterone's going up, the estrogen's going down. I'll talk about some women's health in a little bit. I'm not a gynecologist. I do not study PCOS. I don't know if any of you are dealing with PCOS or have dealt with PCOS in the past, but that's something that can be positively impacted by post-bariatric surgery weight loss. So I probably can't weigh in much more and give an expert opinion on that, but a lot of these studies looked at both topics in men and women, because essentially it kind of encourages the testosterone to go down, which balances out PCOS symptoms in women, as I understand it. And I think what's interesting, and some of you may have even read this study if you've been doing your own research, but one study even suggested that not only the weight loss, which of course we know has a positive impact on testosterone levels, but the surgery itself caused the testosterone to increase, which I think they're relating to improving your insulin resistance. And again, it's one of those things, yeah, it's going to impact your urology health, but it also impacts your overall health. And I think that's pretty exciting. So there's a lot you can talk about when it comes to low testosterone and weight loss. But suffice it to say, there can be a tremendous market improvement. The next thing that sort of segues into that is erectile dysfunction, which impacts many men. Actually, the number one cause of erectile dysfunction in men is cardiovascular disease. And our own governing body, the AUA, if I see a patient with new onset erectile dysfunction, I always have them get a proper cardiovascular evaluation. However, obesity can still have a huge impact, and it has been related to obesity and erectile dysfunction. Sorry, my daughter's throwing a ball in the background. But there's been a connection between erectile dysfunction and obesity for a long period of time. And basically what you see is that BMI greater than 29 has a 30% higher risk of erectile dysfunction than if your BMI is 25 or less. Now, I cannot speak to how much BMI is used versus percent weight loss in the bariatric world. I don't actually know, but a lot of these studies based on BMI, and I suppose that was just because they needed an objective piece of data to look at. But regardless, there is a correlation there, and I think 30% is a pretty impressive number. So, and similar to what they were seeing with some of the other parameters we talked about earlier, which was the low testosterone, the lifestyle change in general, not just the weight loss, but they had, the people in the study arm were increasing their physical activity, which of course is much easier to do when you've, got 50 pounds, 100 pounds off your joints. So, but you improve your sexual function in over a third of the men. So, I mean, I think that's pretty profound, robust data right there. And again, these are important quality of life factors to think about and talk about. And also, before I forget, shameless plug for urologyhealth.org. It's a website that I refer people to very frequently. And it's got a great resource on all the things that I'm talking about. But it was a website that was invented by a urologist he himself had prostate cancer. And it's blown up into this huge patient-centered resource. And it's very patient-friendly and easy to navigate, even if you're not too computer savvy. So I'll say it again at the end, but there's a lot of good urology resources on that, and that are specifically related to obesity and weight loss. So Phil, you should check that out if you have any of the issues that we're talking about. We talked about erectile dysfunction. The other one that's a really hot topic, well, it comes and goes in the media, but can be a hot topic, is prostate cancer. There's a very well-known linkage of prostate cancer to obesity, and I'm sure that's true for various malignancies outside of urology. I probably couldn't tell you much about that or tell you the studies, but there is an impressive link of prostate cancer. And basically, again, they use BMI as the objective data point to look at. But not only, there wasn't ever really a study, at least not that I know of, that links your obesity to developing prostate cancer. I think it's actually more sinister. The data shows a clear correlation between obesity, higher BMI, of course, is what they go by, but between that and your risk of dying of prostate cancer. And I think that's really important, because if any of you have a family member or you yourself have prostate cancer, then prostate cancer comes in a variety of flavors. Some of them we don't even treat anymore. So the fact that obesity, higher BMI correlates to higher risk of dying of prostate cancer, I think is actually pretty serious. And not only that, but it increases your risk of biochemical recurrence, which just means you got treated for your cancer, and now there's at least microscopic evidence that your cancer's returned. And so those are two things that I think are very important from a patient standpoint, but also from my standpoint too. You know, you got to take that seriously. The increased risk of dying is there. I think the data that shows is obesity and the risk of prostate cancer, are those directly related? That's more controversial. I mean, there might be some smaller studies that relate all that stuff, but really nothing set in stone. So other things that affect men more commonly, it's kind of like the overactive bladder symptoms we talked about. It's benign, but just what we call, as urologists, we call them lower urinary tract symptoms. Weak urinary stream, getting up at night to urinate, which, like I mentioned earlier, may or may not be related to the prostate. Frequency, feeling like you can't empty your bladder, or in fact, not emptying your bladder. I think there's two interesting points to talk about here. One is that definitely obese men have more profound symptoms than non-obese men. I can tell you that anecdotally in my day-to-day. I see that very, very frequently. I think I've seen people with that multiple times a day. But more importantly, or maybe equally as important, is that one of the most common procedures we do for men with, we call it BPH, benign prostatic hypertrophy, is a TURP. A lot of people call this the Roto-Rooter procedure. I tell people it's like I'm pouring the apple out from the inside out. However you want to think of it, if you're a man or you have a father or brother who's been through this, you know probably what I'm talking about. But those patients don't respond to TURP that well. And then we're talking about an operation that's been around since before I was born. So it's the gold standard for what it is. And obese men don't seem to have nearly as good surgical outcomes as non-obese men. And so to me, that'd be pretty disappointing to go through something that invasive and not get the outcome I was looking for and still be stuck with the symptoms. So again, it's one of those things. Obesity is linked to developing the symptoms, but furthermore, really impacts the surgical outcome if you end up having a procedure for it. And so that's, you know, for patient and doctor alike, that's quite a bummer. So those are the things, the hot topics I can think of that affect men, specifically obese men. And I can tell you just in my day-to-day, like I said, you guys probably aren't necessarily interested in what I see day-to-day, because that's not just the hard raw data, but certainly corresponds to the people that I see. And you know, and I've certainly seen the benefits of them improving their lifestyle habits, having an impact overall on their urologic health, and of course on their overall health, which is ultimately what you all want. So women, I think the most obvious one and the most common one, and the one that makes the most sense in our heads, is stress incontinence. Women who were able to lose weight definitely have improvement in their stress incontinence. I see it in my own practice all the time. However, there's been paper after paper after very well done study that looks at this. Stress incontinence is, for those who don't know, primarily affects women. I typically only see it profoundly in men who've had their prostate removed for cancer. But it does affect women, and not only affects women who've had children, it affects women who do not have children. But for example, coughing, sneezing, exercising, running. I mean, I have some women who tell me they will not even go for a run or attempt to go to an exercise class because they are wearing pads and they feel like they smell like urine, and it's embarrassing. And I totally get it. You know, that's why I do what I do, I guess. But you know, I think one of the biggest things to know about that is there's. Hello. Hey, I'll be right there. She heard me talking about stress incontinence and she had to come check it out. So in any case, I think it makes sense if you think about it.